All right, guys, welcome to Burt's Basics. My name is Peter Burt. I teach at Box Elder High School. I teach MAP and teach the greatest kids in the entire state. Woo! Today, what we're doing is we're going to start mastering the heart. Okay, so today we're doing cardiovascular, strand 8, but we're focusing really on these guys down here. Let's see if my pen's up and we're ending yet. There we go. These are the guys that we're focused on right there. Blood pressure, pulse locations, cardiac output, things like that. This is what it says in your core you're supposed to be able to do after. So really, number 8, systole and diastole are the ones that are going to catch you off guard. Okay. So now let's go ahead and do a test run real quick. If you went to the doctor, okay, forget all the words now, just kind of look down here. If you went to the doctor and he told you that he puts that sphygmomanometer on your arm and your numbers come back this 122 over 84. I'm just curious, do you even know what those numbers are? Because a lot of people think they do, but they're actually kind of hard to explain. So these are numbers that are related with blood pressure. So these are blood pressure readings. What they do is they take an artery. We'll explain why they take an artery. And they want to know how much pressure is in it. So I think the first thing we need to talk about is that word right there. The word is pressure. Now this is going to be more of a science concept than an anatomy concept. Well, I guess it's an anatomy. It's a whole world concept. There's lots of people who try to explain pressure, and here's how I best explain pressure. Pressure is the amount of times particles hit the wall of their container. I think that's the easiest way to explain pressure. So let's go ahead and take a basketball. Okay, sorry, I have a basketball. I love basketball. Okay, I always play all the time. So what happens is I have a basketball in my truck. Okay, during the winter, it gets a little flat. Why? Well, two reasons. Maybe one, it doesn't have enough air molecules in it to create pressure, or two, since it's cold, they move slower. So they hit the wall a little slower so that could release or lower the pressure. So there's two ways I can fix this. Number one, I can put this under a Bunsen burner, but that probably pop the ball because I don't want to heat them up. Or two, I could just pump more air molecules in here. If I pump more air molecules in here, then you better believe they're going to hit the container more and pressure goes up. This is exactly what we're doing with your artery. Okay? Now forget a basketball. Let's say now this is your artery. I want to know how much pressure there is. So how come I have two numbers? Well, the top number, you can think of it this way. Okay, there's two ways you can think of this. You can either look at it as what is the artery doing, or you can look at it as what is the heart doing, but they're both the same thing. So let's do heart. When your heart contracts, whoosh, 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 all this blood is leaving on the arteries, which means pressure is actually fairly high. Okay? So that is what the top number represents. The top number we call systole. Okay? Systole is another word for contraction. That's when the heart is contracting. Okay? So when the heart's contracting, we're going to have 122 units of pressure pushing on these arteries. So that is 122 units of pressure. So then the question is, what is the artery doing during systole? Well, the artery's bulging. Okay, it's getting big. So then what in the world's the bottom number? Well, the bottom number is diastolic or diastole. That's supposed to be an S, okay? Diastole. Well, it's the exact opposite. So this is when the heart is filling. Now, I like the word filling better than the heart is relaxing. You can put relax here, but it's filling with blood. So this is when the heart's relaxing. So then what are the arteries doing during diastole? Well, they are also starting to relax as well, or to recoil, because they tend to be elastic, so they're recoiling back to their original shape. So now if you can kind of look at my screen really quick. Sorry, I got a big head. Okay. But if you look at it, this is an artery, right? During systole, or the top number, the artery is bulging because of the pressure. So this is 122. Then that blood will shoot by, and it will recoil back to diastole, which is 80. What was our 84? I can't remember what I actually wrote. You don't get to 0. If you get to 0, you're dead. So we don't want to ever get to 0. So look at my hands. 122, 84. 122, 84. 122, 84. And that's what blood pressure is. The top number is the systolic, the bottom number is the diastolic, and it talks about how much pressure your arteries have. And now let's look at the heart. Okay, now on my hands of the heart. See, heart. Okay, so if I'm a heart, systole, contraction, 122. diastole, systole, diastole, systole. And so you got to look at it in those ways. So here's a diagram to try to help you guys out. I don't know if this will help per se. Oops. So here's your top number. Systolic indicates the force when your heart is contracting. Okay, that's the pressure you have. The bottom number is diastole, when your heart is relaxing. So what if you go to the doctor and, I don't know, someone's at 172 over 127? Oh, dear goodness. Remember, we take this generally at rest, when you're sitting at a table, not running a marathon. That means at rest, at rest, at rest. Oh, my goodness. Look how much pressure you're having on that poor artery. So this is my artery down at the bottom, and you have that as your constant blood pressure. Most people should only have 120 units of pressure pushing on them at rest. What if you have hypertension, which is high blood pressure? Okay, that's a good word to write down. Hypertension, where you have more blood pressure than you're supposed to. Look at all those arrows pushing, and say you're 176 at rest. Well, do you understand this is going to damage your artery? And there's a whole classification for disease associated with this. Cannot damage our arteries. It can start to harden. We call that arteriosclerosis. It can start to bulge. Okay, see how that can cause a bulge right there? Okay, we call that an aneurysm. Okay, so we got to make sure we're careful on all of our blood pressure medications. So we got to do it. Now, if we just understand what I just did, big, little, sort of pulses. When you're checking your pulse, when your finger comes out or you feel that bump, that's the artery swelling. That's systolic, diastolic, systolic, diastolic. So if you're going to check a pulse, the first thing you got to do is you have to find an artery. You have to find an artery. Okay, so here's another diagram. I don't mind this one as much either because I like it because it has the, you know, systolic and it's showing the heart's contracting, and diastolic showing the heart is filling. I like that. That's not bad. Okay. This is normal and healthy individuals. Oh, these are O2 sats. Sorry. If you were in class, I have pulse oximeters where it's you guys have seen it before, I'm guessing. Pulse oximeters is when you go to the doctor and they clip on this clip to see how much oxygen saturation you have. Okay, we won't really do that on the online video, but in class we'll do that. I think that's a must. Okay. Blood pressure, here's what we're talking about. If you systolic, remember that's the top number, upper number, right? And then diastolic's the lower number. You're supposed to be 120 over 80. That's what we're supposed to tell you. If you're above this, now every book is different. Okay, I've seen some where they call this pre-hypertensive. Okay, and I don't know. It just depends on which one you're talking about. But there is no question about this. If you're above 130, definitely above 140, you fall in the hypertensive zone, including the diastolic numbers too. Don't forget those, because remember, this is when the artery is resting. So if it's 90, that means it has 10 more units of pressure at rest than it should have. That's crazy. Now, if it gets in these numbers, we're talking life flight emergency room, kind of scary. This graph blows people's minds, okay? This is your aorta, okay? The heart just pumps. And you notice we're starting at roughly 120 and going to 80. But notice what happens as I get further away from the heart. Okay, so I'm going the aorta, I'm doing the descending aorta, I'm going all the way down to the toes. I finally get to smaller arteries called arterioles, I get to capillaries. Capillaries is where gas exchange takes place. If you haven't watched the blood flow video, watch those. Look how much pressure is in capillaries. There's not a lot. And the reason why is because he's far away from the heart. What's even crazier is look at the veins. There is no pressure down here. So when we talk about pulses, when we talk about blood pressure, we are checking this guy. We're checking arteries. Okay, that's what we're checking on here. Okay, now let's talk about where we can find pulses. So I'm going to kind of put my face up here and do this at the same time. So there are lots of places you can take pulses on the body. Okay, and I'm supposed to teach you 6. The state wants me to teach you 6. We're going to start superiorly and work our way inferiorly. So the biggest one we can check is carotid. Okay, try not to use your thumb. He has his own pulse rating for palpation, right? So we have the carotid in the neck, which we learned that coming off the aortic arch, right? Your brachial. Remember how we talked about the subclavian goes to your shoulder and to your arm? Well, you can't call this the clavicle artery in your arm because the clavicle is up here. So then it turns in your brachial. So what you do is you take your arm, You kind of push it, and then if you collapse that brachial you should be able to feel the pulse right there in your brachial artery. So while we're doing these, go ahead and try to find your carotid, find your brachial. Let's travel down, and now let's go ahead and do the radial pulse. Now remember, trick on anatomy. You have two bones in your forearm. You have your radius and your ulna. The radius is always the rad one. So it's the radius on the rad side. Okay, the radius is on your thumb side, so you have a radial pulse too you can take there. Okay, femoral pulse. I've never actually checked the femoral pulse before on a person because to check the femoral pulse, you kind of got to get up close and personal, which I don't like to do. But that's your femoral pulse if you guys want to kind of find that one. And my favorite one, the popliteal joint. Okay, the popliteal pulse. Now this one's a little bit harder because it's the back of the knee. So what I think about it is me and my wife used to do yoga. She made me do yoga. And the first time I went to yoga, I remember I brought a Pepsi. And she's like, you can't bring a Pepsi to yoga? I'm like, well, too bad. Okay. So I put it on my mat, but I was worried about spilling it. So while we're doing like downward dog, okay? Sorry, I'm going to stand up for this. While we're doing like downward dog, I'm like, man, I don't want to spill my Pepsi. So I thought about taking my Pepsi, my can of pop, and putting it right here in this little crevice to keep it safe, right? And that's what I always think of. I know it's stupid and I know it's dumb, but I always think of this as my pop site. That's where I put my can of Pepsi, my popliteal site, okay? And then if you want to know, I put my Rubik's Cube right here because this is called my cubital fossa, this depression right here. So I put my Rubik's Cube here, Pepsi here, cubital, popliteal, yoga pose, okay? So that's what I think of when I think of those guys. And then you can check one on your foot, okay? The foot one is called your dorsal pedalis pulse, okay? So those are the ones we're going to do. So let's start again at the top, work our way down. We got carotid, brachial, radial, femoral, popliteal, and dorsal pedalis. So those are all our pulse poises we are going to check. Okay, let's finish with cardiac output, and then we are done with this video. So cardiac output is the following, okay? It's a test to see how well someone's heart is doing, okay? And so what we want to do is it's a simple math equation. If it's okay, I'm going to write it out for you. Cardiac output equals two things times together, and it's called SV and HR. HR stands for heart rate, which you guys aren't too bad about that one. You guys know heart rate really well. So let's give me a pulse. Let's go ahead and say, I don't know, 70 beats per minute. Let's say that's your pulse rate, okay? So you guys can check your pulse, time it out. You can fill in that number. Now, stroke SV is a little bit harder. SV stands for stroke volume. Now, stroke volume is a little more difficult to explain. This is how many milliliters leave your heart per beat. So if your heart contracts, and I want to know how many, let's go up here, sorry. If your heart contracts and out comes blood, I measure how that quantity of blood that just left, and that is your stroke volume. Now, this one you guys can't do on your own. So I'm going to give you a number. Okay, the average for a person that every book gives you is 70. Okay, 70 beats per, or sorry, 70 mils per beat. So every time, oh, let me get my pen out. Every time your heart beats, 70 mils of blood pumps. So here's your heart. It shoots out blood. That's called your stroke volume, and it's roughly 70 mils per beat. Sorry, it's kind of hard to see my drawing. I should have picked a different color. So now, if you guys time this together, 70 times 70 is 4,900. 4,900 what? Exactly. Well, let's look. Stroke volume is mils per beat, and heart rate is beats per minute. So now what happens if I have beats on the bottom and beats on the top? Well, they cancel each other out. I should probably write this more natural so it looks more natural. So this is 70 mils per beat. There you go. That probably looks better. Well, if I have beats on top, beats on bottom, I can cross those guys out. They no longer exist, and there is only left some units. Cardiac output is how many mils leave your heart per minute. 4,900 mils per minute. You guys don't like mils. I get this. So we are going to call this then 4.9 liters per minute. That's cardiac output. Okay, and there's a lot of things that can change as your heart rate goes up, your stroke volume goes down. There's lots of things you can play around with this. But the average person, you should have 5 liters of blood leaving your heart per minute. And we call that cardiac output. Thanks for watching Burt's Basics. Okay, I'll see you guys on the flip side.